Hi, fine, fit, over 50 folks. I practiced that alliteration so I would get it just right. No, you're not seeing double, but my guest today, who I'm very excited to talk to, is a gentleman who is at the forefront of the critically needed and rapidly developing bridge between what I would term preventive wellness, the hub of which I would consider practices like healthy eating, regular exercise, between that realm and traditional uh, pharmaceutical rehab and surgical interventional medicine. So he's got quite an interesting background. So I yield to our guest, Jeff Young. And Jeff, tell them, if you would, before you go into your background a little bit, just your the letters behind your name, what they mean. I think a lot of people, they're impressed by that stuff, but they don't necessarily know what a CSCS. Most people know what a doctoral student, all that stuff. But go ahead and share that first, even though it's a little bit dry. I want people to know the level of your qualifications and authority and that
Sure.
sort
Yeah. First of all, great meeting you, and thanks for having me on the show. I really appreciate it.
of
Look
pleasure.
forward to our discussion. But yeah, the starting with the academic part of my background and what those letters mean. I have a bachelor's. I don't have the BS behind my name, but I have a bachelor's in kinesiology. And when we get a little bit more into my background, I think it's important for me to touch on that because it's a really important part of my philosophy and approach in medical fitness. But in any case, I have a bachelor's in kinesiology. I have the MS is a master's degree in exercise and sports science with a focus in strength and conditioning. Even though my diploma says exercise and sports science, the way I look at it is I have a master's in strength and conditioning. And then my doctorate, you know, a lot of people I've come to realize that when they think of a doctorate, they think of PhD, being a researcher. But I actually am going the EdD route, so a doctor of education, and for reasons that I won't bore you and your audience with. But yeah, so I'm pursuing an EdD in kinesiology with a focus in strength and conditioning. So while the diploma will end up saying kinesiology, I look at it as I have a I'm getting ready to get a doctorate in strength and conditioning, and I'm a doctoral candidate. I actually just finished the term. I only have 3 traditional courses left in my dissertation, and then I graduate. So the light is at the end of the tunnel. It's a little bit
That's
surreal to
great.
me because I turned 60 in 5 months. So I'm doing this real late in my career, obviously, and it was actually never part of the game plan. But yeah, that's it. Oh, and then the CSCS, that is a certified strength and conditioning specialist. So that's the National Strength and Conditioning Association's gold standard strength
Right.
and conditioning cert. So the way I look at it is I have a bachelor's in strength and conditioning, I have a master's in strength and conditioning, I'm getting a doctorate in strength and conditioning, I'm a certified strength and conditioning specialist, and then I also teach courses at a local college here in New York City on all that stuff. So
Great. And I just want to
that's
intervene very quickly. Uh, I'll be 63 in May, and I went back for my master's at 59.
yeah,
And my master's is in exercise, phys, and sports nutrition, and I got a CSCS also as part of that program. And that was that was pretty rigorous, having compared the ACE and ASM personal training certification processes.
absolutely.
And that was at the time I took the certifications. I had no background, no formal background in exercise. So the CSCS, the reason I pursued that and I wanted to make that my capstone is because it required a deeper level of understanding for the stresses on the body, how the body responds both internally and in terms of musculoskeletal and endurance capacity increasing. That even though most of my clients and most of the folks watching this are not necessarily competitive athletes or athletes that engage at a level of intensity that requires very precise training and management of their nutrition, to have a view on that at a higher level of demand is so important to better understand how to manage below that level of demand, how to kind of dial that in with precision.
I will add to that, and this is something that honestly, we were talking before we hit record about, the podcasters out there with 1, 2, and 3 hour length podcasts, and this topic alone I could talk to you about for the next hour or two, but we don't have
Sure.
that much time. But let me just say that I've been working. I'm in my 30th year. I've been working mostly in clinical settings, hospital settings, and private practices. And but I consider myself a strength and conditioning coach. And so again, at CUNY, City University of New York, it's a system here in New York City with about 25 institutions. And so I teach at CUNY York College in Jamaica, Queens, and I teach 5 courses. I teach strength and conditioning, um, exercise prescription for special populations. So that's going to be older adults and the chronic disease side of the exercise programming side of the equation. I teach sports medicine and rehab. So that's going to be the orthopedic and musculoskeletal condition and joint pain
Right.
side of the equation. I teach a weight training lab. So that's going to be the proper form on squats and deads and lunges side of the equation. I also teach nutrition and health. But the reason why I bring that up is because it doesn't matter whether I'm speaking at a conference, I'm teaching my students at York College, I'm doing stuff through the Medicine Rehab Fitness Institute, whatever the case may be. I teach through the lens of a strength and conditioning perspective, period. You can talk about, here's how I look at it. You can talk about the word fitness all you want, but when you break fitness down, we need to be stronger and more conditioned. So there's strength and conditioning, and then
Right.
the power component and the lean muscle tissue component as well. So yeah, my lens is strength and conditioning. It just happens to be for mostly special populations.
Well, that's a really great point to make because, like you say, we kind of have this vague sense of what the words fitness and nutrition mean, but the term strength and conditioning very specifically focuses on the output, right? The outcome, the result of the work, and the
Right.
value, the inherent value of those results.
That's exactly right. And I personally think it just gives more clarity to the word too. It can be
Absolutely.
somewhat of an what is fitness, and people will get in their little social media arguments on what fitness is and what it means and all that stuff. I think that strength and conditioning starts to give you a little bit more clarity, and and then we can start attaching numbers and performance to that as well. And you don't have to be an athlete. Even if you're uh old decrepit people like you and me, we
Right.
still want to improve our performance on,
Yep.
whether it's aerobically or strength or whatever the case may be.
Right, right. And that's a great point, especially for my audience who you mentioned social media. There's such a strong impulse to want to compare yourself to others as a benchmark. And in some cases, it's ego driven. And I think other cases, it's just trying to get a read on the distribution curve and kind of where you think that you should be based on the things that you're doing or the things that you should be doing or whatever. And, at a very broad level, I think with each passing decade, it becomes more about quality of life, vitality, even cognitive capacity, but certainly wanting to enjoy and be integrated in family and friends activities that may span, your friend group may span 3 or 4 decades kind of thing, where, and especially I think since we dedicated ourselves to being continual students, and you more so than me, but me my own sort of way, making the focus of teaching the means by which we become continually more dedicated and well equipped students. That having that awareness of how different motivations and different reference points can be helpful or it can just be absolutely confusing. So I love the idea of the direction and the clarity, and I to step off from that, I'd love for you to share more about MFI and any other sort of activities, organizations that are connected to that, and kind of what that's all about, and your what sort of drove, I mean, that's a big thing to take up a cause like that and spearhead that. So tell us about that.
Sure. And again, here's another hour-long conversation that we're gonna make succinct in a few minutes. But my I graduated from Penn State in 1996, and my first job out of college was at Duke University Medical Center's Diet and Fitness Center, which at the time was arguably the leading medical weight loss facility in the United States. And they had this was a place that really did it right, at least when I was there. So they had medicine, nutrition, fitness, and behavior components, which would be four of the six pillars of lifestyle medicine. And we truly integrated. We truly, had weekly meetings, and we weren't these separate silos like the world is today. So, I'm just out of college. I'm green. I think that this is the way the world works. But the point is that I started my career off at a world-class facility and then on the right side of the fence, seeing how things kind of should be done. And then I moved to New York City, where I immediately see, uh, this is not the way the world works. One says this, the next says that, and etc. And then, I've been staff at UCLA, Beth Israel, and Mount Sinai medical centers. And without naming names, some of them did things better than others, but what drove the creation of the Medicine Rehab Fitness Institute, um, was really, to be honest with you, frustration and seeing that the bad side of the fence and the silos and all the egos that are involved in healthcare and the totem pole. We're above you, you're fitness trainers, so you're at the bottom of the totem pole, and not seeing things as a continuum. And then, no, we actually have our role within the healthcare continuum, and we'd actually collaborate. For public health sake and for the patient's sake, it'd be better if we just collaborated
Right.
and work together rather than have this totem pole mentality. So
Right.
there's way more to it than that, but the gist of it is just circumstances dictate life for the most part. And through circumstance, back in 2020, I met one of the co-founders, Dr. or the co-founder, Dr. Thomas Hammett, who's a physical therapist. He's in the Seattle area, and we just hit it off from day one. And I've been working alongside physical therapists for 20 years, and orthopedists, physiatrists, occupational therapists, chiropractors, like the whole sports medicine rehab continuum, to include here in the New York City, Mount Sinai, Knicks, Yankees, Nets, Liberty, USA Rugby, like top of the line. And as soon as I met him, I was like, no, this guy's different. I've never met anyone like this.
Right.
So, without going into deep of a story, we just hit it off, that bromance thing.
Right.
And he was a PT who just really understood that physical therapy should really be viewed more as a pit stop for the patient and as an
Right.
opportunity to move them to fitness, strength and conditioning, rather than the home exercise program that nearly
Right.
everyone is being discharged to. So we started having weekly meetings back in 2020, and then the idea to create the Medicine Rehab Fitness Institute formed, and then we ended up bringing on a physician assistant named Sheila Aubois, who represents the medicine side. Then we have a soft but growing partnership with the Medical Fitness Association. So we have our podcasts, the Medical Fitness Podcast, and all of that just ties together with. And then I'm also just involved with other organizations like the American College of Lifestyle Medicine, um, and also, here's another thing to throw in there real quick. The Physical Activity Alliance, which is an organization that formed back in 2020, and they've been working in the background to professionalize the fitness industry so that somewhere in about 2 years or so, 2, 3 years, licensed clinicians will be able to bill insurance for the services of what's called qualified fitness professionals. And so they've been doing this in the background for the last 4 years. And right place, right time, I got involved in a working group with them right when they first got started. Another just circumstance thing. And long story short, they've been doing this now for 4 years, implementing the strategies and the policy change and stuff like that at like the Capitol Hill level. But the implementation needs to happen at the state and local and community levels. And I'm the founder and director of a New York State um, coalition, New York State Physical Activity Coalition, that is the state level implementation of the Physical Activities National Physical Activity Plan. We're only a few months into it, but it's another hat I wear, and it's a long-winded way of saying that whether it's at the national, the state, the local, the organizational level, the MRF Institute level, etc. I'm very, very passionate and involved about movement, physical activity, and building this bridge between medicine, rehab, and fitness.
Right. And it's funny you mentioned the process level integration of medical insurance and services that would help people avoid injury and illness. That's such an important development to both bridge that gap on a practical level and demystify it for those who will be taking advantage of that once it becomes more widespread. So I really salute you for putting your time and energy there. And I'm trying to figure out how you sleep when you get time to sleep.
It's funny because people say it all the time, and my response to that is number one, it's a labor of love, right? So my work is hobby, so it's a
Right.
labor of love, and so I don't see it as work. And number two, the way I look at it is, it doesn't matter who my audience is for the most part. It can be clinicians, it can be fitness professionals, it can be my students at York College, it can be the layperson.
Right.
It's all the same language. We're teaching exercise. We're
Right.
teaching how to do it properly and
Right.
safely, and the frequency, the sets, the reps, the
Right.
rest periods, all those variables that are involved in designing a program. And I have, at this point now, 30 years of my career, I've got all the content on my laptop, right? And
Yeah.
so it's just a matter of taking this content and mix and match it for whoever my audience is. And so it sounds like it's a lot, but it's gotten easy for me to be
Yeah.
organized and do it efficiently.
Same thing for me, right around 30 years, but my suspicion is that your information is much more well organized than mine is.
Hey, who
I have a
knows? Well,
YouTube channel that has some exercise. I was talking to a client this morning. I have this lower body stretch sequence that I've recommended to really most of my clients because they usually have some issue with hamstring tightness or hip glute inflexibility, definitely limited range of motion in some cases, severe, sometimes large disparities between their hip glute, freedom of movement, and their hamstrings. So for instance, I might have a tennis player that has really tight hips, or I might have a cyclist who has really tight hamstrings, or, sometimes just people who are sedentary, right? Have those issues. So the YouTube channel that I'm trying to cultivate now with my more focused content is Dan Taylor, MSCSCS. But the old one has both all of these little exercise sequences that I've given to a bunch of clients, and my middle kids kindergarten Thanksgiving play where he's he's a turkey. So I'm in the process of getting more and more organized, but thank you for the inspiration. I will put more effort into that because, like you say, there are a lot of times where it's just okay, I think it's something that would be helpful to somebody, and then I have to go through and find the YouTube video, or might be your podcast that I watched the week before. Hey, here's a link, go check this out, right? So
if I can respond real quickly and just say that I'm just speaking from my experience and standpoint, but what helped me get organized is back in like maybe 2006, give or take. It was actually another circumstantial thing where I was working out with a clinician that I worked with at Mount Sinai, who happened to be the head team physician and medical director for USA Women's Rugby, and we were working out at a New York sports club. And you can tell I'm a talker and she's a talker, so we're yapping to each other. And the fitness manager came up and started talking to us. And long story short, he said, "Hey, would you be interested in presenting on medical fitness to my trainers?" And that I had done some presenting before, but that was like my first time in that atmosphere and blah blah blah. Anyways, that ended up blowing up, and I started like regularly presenting at New York sports clubs, and then Crunch, and then Equinox, and stuff like that. And the point I'm getting at is that and I know you can relate to this, but putting yourself in teacher position, that's actually what got me to be more organized, because it's like, you know, you got to be organized to be in a teacher position. And also you're you're occasionally going to run into someone in the audience. I'm being maybe a little bit politically incorrect here, but it's just the truth. You're occasionally going to run into someone in the audience who is a bad apple, for lack of, in the sense of they're challenging you, or, being disagreeable almost on purpose or
Right.
whatever. And
Right.
so that's another reason why I had to become really organized, is because putting myself in that position, and then all of a sudden having these circumstances, oh man, and it just makes you realize you got to be that much more prepared. You got to be, you got to be on your A game. And
Right.
so all that is the reason why I became a very organized person with my content.
So I'm really glad that you mentioned that, Jeff, because the corollary for our audience is that they're exposed to a blizzard of pronouncements, claims, declarations, demonstrations that are heavily edited, out of context. It's so important for people who want to become more well-versed in exercise and nutrition, how they interact, their connections to wellness, improved quality of life, that they vet their sources, that they do have, that they're aware that there are qualifications that separate one source from another source. And they should, like we're doing today, they should gravitate towards sources of comparable, complementary, or even if it's subordinate to primary, these one of the things I challenge myself, if I have an assumption, I know enough about who to talk to find out if I'm on the right track, or if I'm a little bit, it's yes in this situation, but in a broader application, maybe not so much in here, the exceptions, that sort of thing. People really need to hold themselves to developing a relationship, even if it's one way, even if they're just receiving it, to hold themselves accountable to directing their attention to quality resources for guidance on
Yeah,
this.
and please let me respond to that, because this is something I'm ridiculously passionate about. I'm a student at Penn State University, and I'm a junior. It's 1995. Right place. Here we go again with my word circumstance. Right place, right time.
Right.
I got involved in what at the time was the longest strength and conditioning study that had ever been performed. It was under the direction of Dr. Bill Kramer, who is widely considered the premier sports scientist and strength and conditioning researcher in the world, and one of the founding fathers of the National Strength and Conditioning Association. And it was a landmark study. So it was a programming study, a personal training study. It was on. So when you're the four primary physiological adaptations to exercise are strength, conditioning, power, and hypertrophy. And it was a study on how to optimize those things. So here I am, as a student at Penn State, and I'm in the involved in at the time the longest strength and conditioning study ever performed, under the direction of the Einstein of strength and conditioning, learning about how to program correctly. So in any case, with that as a background, and I also had Dr. Kramer as my academic advisor, and then I maintained a mentor-mentee relationship with him, as really through much of my career, but especially for the first decade or so. And so now, with that as a background, as a response to what you just said, there is a phrase. Now, I actually was looking it up while you were talking. I was listening to you, but I was also looking it up.
That's fine.
Harrington Emerson has a quote, and this is what Dr. Kramer said to me way back then, that is always speaking in my mind.
Yeah.
As to methods, there may be a million and then some, but principles are few. The man who grasps principles can successfully select his own methods. The man who tries methods ignoring principles is sure to have trouble. So going back to Dr. Kramer, one of the things that he drilled in my head 30 years ago as a student and as my academic advisor, and then through those first 10 years, learn your fundamental principles, your
Beautiful.
first principles of exercise. Learn your, and there's going to be one person says you should program this way, and another says that way, and you have all these different methods that are out there,
Right.
but principles are few. And
Right.
therefore, and they're also common sense. And so now let's go back to the CSCS and NSCA. That's another reason why I'm just a big fan of, for example, that certification, because it's a great foundational resource to learn principles of physiology, of bioenergetics, of programming, of periodization and
Right.
Henneman's size principle and things like that. And so in any case, I know I could keep going on and on, but the point here is learn your fundamentals. That's your baseline knowledge. And all the research and stuff like that is just going to build on that. But
Right.
learn your fundamentals, don't stray from them.
Right.
And then you won't be deceived by one says this, the next says that. It'll be a lot easier for you to be able to differentiate between what's accurate and what's inaccurate, what's optimal and what's suboptimal, what's right and what's wrong.
Right. And I would say, just to add to that, because you're right, we could go on forever, and I'm really enjoying our conversation. But the best teachers will provide rationale that makes sense, not only reinforces the principles, but also gives you a context that helps you
Absolutely.
invest more deeply and be more confident about those principles.
Absolutely.
So, okay, so I really do want to be respectful of your time and also as brief as we can be, although this is all, very, it's great information for people to have. But the kind of the broader view for most of my audience would be, okay, so what are some of the best things that I can do to make sure that my exercise and nutrition habits are um, properly aligned and generally practiced, even if the methods can change for specifics or evolution of my lifestyle or whatever it is. Uh, that how do I know that I'm on the right track for exercising and eating in a way that's going to likely reduce my risk of injury, lower my vulnerability to bacterial infections, metabolic disorders, that sort of thing. So that's something that I'm sure you have a wealth of information to share with. And so what I'm going to do is on the blog post that I include this video on, I'd like to ask you to send me the links of yours that you think would be most valuable to my clients. And again, this is over 50 physically active to very fit community. But I wanted to share a personal anecdote that I briefly touched on before we started to record our conversation. And my daughter, who is she's going to be 21 in September, and she's a vegan bodybuilder, but she's asking me more and more these days. She's at ASU, so we keep in touch via text and Zoom. But she asked me what I thought about exercising with a cold. And the context for her is she doesn't do a whole lot of cardio because her main objective, because she's Barbie wrists. She's got mine and my ex-wife's genes, where she's very, very slender. So she has to work really hard to put on the muscle that she's trying to put on. So most of her focus is on hypertrophy, building muscle size and volume. And of course, she's getting older and she's maturing into that, but that's where her focus is from a strength and conditioning standpoint, increasing her muscle volume and maintaining that. So I know she's not playing racquetball or going on long bike rides or whatever. So here's the question: how bad is it to work out while you have a cold? Now, I had about 7 seconds to respond while my client was doing their post-workout recovery and having some water. So here's my response, but slash and burn at will, Jeff. But give us an answer that you would provide somebody if you had more like a minute to respond to it. I said, thanks, depends on severity. Bigger issue is taking airborne and contact pathogens slash germs, bacteria into the gym and exposing others. So I didn't go into a lot of detail for her personally, because as her dad and as a fitness, wellness, health educator, I wanted to take a broader view and have her be responsible about that degree of risk she might be exposing others to.
Okay. Couldn't
So,
agree more.
okay,
Yeah, I mean, I'll add a couple things, but I don't.
please do.
First of all, yeah, you have to think of selfish and unselfish. You have to think of uh, yourself and what does it mean for you and what that workout for the day and maybe your long-term goals or whatever. But you also have to think of public health, and I'm really glad that was part of your answer, because you do have to be unselfish in that sense and think of public health. So it kind of depends on where you're at in your cold. And I actually don't know what the research is as far as how long are you contagious. I mean, we all hear about those things,
Right.
but I don't know if it's just subjective and anecdotal or not. So that part I don't know, I don't really have a strong answer to, but I kind of think it depends on where you're at in the cold. But one thing I will say, just to add a little bit to what you said, so I can at least sound like I know a thing or two, is there's a concept called readiness to train, and it's basically just a screen. And so whether the coach is screening the athlete or the client, or whether the person is screening themselves, you should screen yourself, or a screen should be performed prior to every session. And the way in medical fitness, the way we go about it is, how do you feel? And then you want to dive deeper into that. How do you feel? So what does that even mean? Like on a numerical scale,
Right.
0 to 10, with 0 you feel perfect, and 10 you need to go
Right.
to
Right.
ICU or whatever. Where do you feel on a
Right.
scale of 1 to 10? Descriptive. Where do
Right.
you feel from a descriptive standpoint? Energy wise. And then since we're talking about cold, how's your throat feel? And like my understanding is that if it's in the head, you really should be avoiding working out. If it's in the head, you avoid it. And if it's I think that's how it goes.
So with the parameters I've heard in the past, and it jives with everything that we've talked about so far, is if you're feverish, stay away because your body is in
Absolutely.
internal inflammation and it's working out higher priorities than whether you keep your 12 rep max with a 20-pound
Right.
dumbbell on the curl. But that if it's a respiratory issue, let's say you're getting over, bronchitis or something like that, that
Yeah,
you probably don't want to do any hill sprints or long runs.
absolutely.
And if it's strength training, then that's not necessarily as big of an issue as, just like you said, your general malaise or sense of
Yes.
energy capacity. But again, we were talking about principles versus processes, right? So the one of the ways I've suggested clients who are, especially during COVID, when most people were working out at home, all of my business was on Zoom at that time. What I would recommend is, if they were really itching to get back to it and they felt generally, let's say 75, 80% better, to hold off on longer sustained cardio or anaerobic power bursts kind of thing, and really focus on good strict form using maybe 70 to 75%, 80% tops of your normal 8 to 12 rep failure range, and doing 5 or 6 reps stopping and doing at least a 1-to-1 rest to work ratio, and then just doing compound pull, compound push, compound lower body movement, and then stop, check in, see how you feel. And that seems to work pretty well. For me, what I've done in the past is, if I was getting over just a bad cold, most people are going to have more bad colds and flus, or, twisted ankles or whatever. Is even if I felt pretty close to 100%, I'll do a 1/4 workout, like a 1/4 length, maybe half to 3/4 intensity workout, even if I feel like doing a half workout. And then I'll skip a day. And I usually do a multi-format cardio, strength, and core, some flexibility too. So I'll do a quarter workout, skip a day, half workout if I'm still feeling good. If not, then I back off, and I'll take 3 workouts to get back to my full workout. And that seems to work pretty well. I tend to recommend my clients go even more conservatively within that, with their progression, and to be very, very err on the side of ramping up more slowly. And that seems to work.
There's nothing that you said. I think that is outstanding, and I completely agree
Jordan,
with it.
thank you, Teach.
Yeah, no, absolutely. There's nothing to add. I think it's a perfect response. Maybe a way to think about it is a deload week. You're using it as a deload week, or so,
Yeah,
and then
athletes
there's
like
all
that
kinds of ways
language.
you can, yeah,
Yeah,
you can just play around with the deload. What
right.
does that mean?
Yeah,
Or something like that. And one last thing I'll add is the auto regulation, which the way I look at that jargon is it just means adjust the session according to how you feel. So, and you touched on, or you really hit on that. You auto regulate the session. You go into the session, you screen yourself with the readiness to train, and then within the session, you adjust the volume, the intensity based on how you feel. Also taking the public into consideration as well. And then you also hit on something that I didn't really touch on, was what does it mean for aerobic exercise and what does it mean for resistance training? And for aerobic exercise, absolutely. If it's a cold, it's going to be that now your respiratory system is being affected, and you have to think about that, and you probably have to back off more or whatever the case may be. But everything you said is there's on point. Nothing that I can chop up. It's on point.
Okay. Well, I so appreciate your time, Jeff, and I've learned a lot and really happy that we got a chance to get to know each other a little bit better. Any parting thoughts you'd like to leave the audience with, or if again, I'll give them whatever links you provide, but if you want to plug something, I'm happy to have you.
Yeah. Hey, the MRF Institute. So it's www.mrfinstitute, all one word. It stands for Medicine Rehab Fitness Institute.org, not .com. I'm not really an Instagram person. I'm not on, I scroll through TikTok every once in a while, but I don't really do anything on TikTok either. I'm mostly Facebook and LinkedIn. So
Same.
I can email you my, my links for that.
That
But
would be
other than
great.
that, no real parting words other than, please follow me, and and just
All right.
again,
Well, I'll post this interview on both Facebook and LinkedIn and keep you updated. And again, thank you so much for your time, and I hope you have a terrific day.
yeah, you do the same. I really appreciate it.
All right. Take care.